Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster with my guest today, Guy Berardo, CEO and co-founder at Sami. Guy, great to see you.
Good to be here. Thanks for having me. It's a pleasure to be here, Startup Health.
It has been really cool to watch your progress as you have built this digital-first health insurance company in Brazil. A lot of our audience is probably unfamiliar with the Brazilian healthcare landscape. And so just let's start with a level set of that environment that you're innovating in.
Absolutely. Brazil is the third largest private health insurance market worldwide, so it's a pretty massive market. We have, Brazil's got 220 million people, but I think the real positive thing here for us as a company to explore at Sami is that only 25% of the Brazilian market is insured and still is the third largest worldwide. So insurance penetration is really low, and healthcare is extremely broken in the public sector. So it's a big opportunity when you think of a private health
Give me
insurance
a couple
market.
examples of why you say it's broken.
Zero care coordination, absolutely. If you think of fee-for-service based and lack of value-based care, and just no care integration, no data interoperability across systems, and so very difficult in navigating care and very difficult in bringing transparency into the system.
Okay. So you got together with your co-founder and you said, you know what, there's a better way here. So tell me a little bit about that origin story of launching the company.
Absolutely. So I'm a third-time entrepreneur. I've been in healthcare for more than 15 years. I built Brazil's first post-acute care network, then a network of primary care, and now into Sami. And the whole vision of Sami was, I had been a provider before for many years, and I seen how the entire value chain was broken. And even if you were just a piece on a value chain, if we're a tech company, within that broken value chain, we wouldn't be solving for the biggest problem. And so our idea was, the value chain is broken, and if you can reorganize that, and meaning having value-based pay contracts with hospitals, laboratories, diagnostics, and starting with the HMO type of organization with a mandatory gatekeeping model into the system, and then, only then, layer that up with technology, then we'd have a chance to break into that market and do something really meaningful and transformational. So that was our approach to the problem initially.
Okay. Talk to me more about that mandatory gatekeeper idea, because I know that's somewhat unique to your model.
Yeah, absolutely. In Brazil, most of the health insurance, they're all PPO-like, but the thing is, inflation rate in Brazil runs at 4 or 5% year on year, but medical inflation runs at 4 or 5 times.
Oh, wow.
So you're thinking small entrepreneurs and SMBs, those companies are used to paying 30, 40% year-on-year price increase.
Oh, wow.
And so this has become very, very unsustainable. And so our model, when you think of HMOs in Brazil, we're one of the first companies to be a full HMO with a narrow network, but with a very accessible digital entry point into the system. So we don't like to think of gatekeeping model because we give a lot of access, but on a digital basis. And so our members are really engaged. Our NPS on the care team, which we run, sits at between 89 and 95. So it's a really great engagement tool when you're thinking from population health standpoint, extremely high engagement. And so that has a little bit different model than if you think of a brick and mortar type of organization that you need to go
where your first
physically.
touch is the gatekeeper versus all the digital.
And it can be very frustrating to the members.
Talk to me, in reading about Sami, there were some things that really intrigued me about the way you're using data around fitness and wellness, because you give...
we have a partnership with GymPass.
Exactly. Okay, that was it. Tell me more about the GymPass partnership.
Yeah, since the beginning, we thought, our biggest bet, we like to think ourselves as a population health business that happens to be a carrier, right? So from the beginning, our bet was, we're going to invest on population health, and that has to do with exercise and being healthy, and not only the care piece to it, right?
Preventative health.
And we struck a partnership with GymPass, and now, looking at almost 3 years of data, we see that the engaged members, and that's very interesting, have some of those cohorts, they have 25 to 30% lower loss ratio and lower churn as well. So it's not only an engagement tool, but you keep those folks healthier.
It's not enough
longer.
for an insurance company to give you a discount to a gym if you never use it.
Yeah, absolutely.
Yeah.
So, and that platform, along with all the tools within our app, mental health applications, and all the access that we have digitally. So the engagement level is really high. We have 85% monthly active usership on our app. So that's remarkable considering a health insurance company. Those are some of the metrics that we're happy to share.
So you're coming into a massive market, and the game here is more users, more users, more users. What has your trajectory been like?
We just crossed 20,000 members. We'll celebrate our third year of operation. So we've had a pretty aggressive growth story, but still very small thinking of Brazilian terms. We're thinking our addressable market is more like 100 million people. Yeah. So we haven't dented the society, but I think from a structural delivery point, the way we deliver primary care, which is 95% of all the clinical interventions on the primary care are digitally.
Wow.
That's
revolutionary.
This is completely different from a cost structure standpoint. Yeah. And so as we scale, cost to delivery care will lower even more than what it is now. And to give you a sense today, our cost structure on a yearly base, on a per member per month, adding that up into the year, our cost structure is only about 15% higher than the biggest player in Brazil that has 14 million members.
Wow.
And we only have 20,000. So we're completely subscale, and we're still being able to deliver care at substantially lower cost compared to all the other carriers.
What do you think it's going to take for you to pass that inflection point and start to scale up the way that you want to?
I think next year is, now we start to sell to larger companies. So we celebrated a few large contracts in the last couple of months, which we started with the gig economy workers, then real small SMBs. And then this quarter, we closed contracts with employers with 700 employees, 900 employees.
So that's
we're starting to get into larger companies. And look after us next year. You know, it's coming. That's what we're doing. So we're starting, not only we're serving the underserved population, which 75% of our members did not have health insurance before. So there's this sort of a blue ocean there, but also the companies that are being insured, they're currently insured, but they're looking for another alternative, and Sami is set up to be that alternative right now.
Last question. I'm always curious about situations like yours where you have this opportunity for what we call leapfrog innovation, where you can come to the U.S. or a conference like this, and you can say, "Look, there's another digital health insurance provider. We're gonna improve on what they've done. We're not, going to repeat the mistakes of the past, and we're going to bring back a better version for our people." So, what are some ways that you feel like you've been able to leapfrog mistakes of earlier versions of this?
I think we've seen a lot of what came before us, and I think one of the big strong aspect of our culture is to learn from past mistakes. And obviously, we do our own mistakes as we grow, and that's natural. Yeah. But we've been able to learn a lot from other companies. And I think our approach on the beginning to make sure that we had that. I don't like to use that term, that mandatory gatekeeping into the model, which other companies before didn't do it. Sure. But when you attach the digital access and you incentivize access digitally and you give that access, our response time on the care team on our app was less than 5 minutes. That is very different than if you're thinking, I'm going to have a digital tool, but I'm a PPO, and then the members are still lost within the network. Yeah. That doesn't happen in our case. So that was a bet that we put on the beginning, and it proved to be very successful. Our company, our loss ratio sits at low 70s, which is best in class by far worldwide. So we've been very successful with that strategy. So learning from other people's mistakes. Awesome. That's a good strategy.
Yeah, it's great. Guy, it's been great to get the update. It's really exciting to watch your growth as you really create a whole new category there in Brazil. It's going to be exciting to see you scale up in 2024. So appreciate you coming by.
Thank you. It's a pleasure to be here.
Be well. Thanks, Guy.
Thank you.